Republican governors across the country are working to roll back the Obama administration's Medicaid expansion, which added more low-income people to the program. They're imposing a new requirement that forces some people to work to keep their coverage. The poster child for this policy is Kentucky, where beneficiaries will have to work 80 hours a month to earn their medical care and could be facing the highest premiums ever approved under Medicaid. The policy is going to affect nearly 500,000 people, and nearly 100,000 might end up losing coverage.
For the last month, the Medicaid expansion population in Kentucky have been treated like pawns.
The lady that I know that works with Shawnee Christian Healthcare called me. Did you know that they canceled dental? I was like, no, I didn't know that. And here I am, I'm like right in the middle of having my whole mouth done.
That's because Kentucky Governor Matt Bevin has been playing a political game with their healthcare. After his plan to overhaul Medicaid was temporarily blocked by a judge, Bevin cut dental, vision, and transportation benefits for nearly 500,000 people.
What are you having done?
I'm getting dentures on the top, which is embarrassing to say for the people.
Why is it embarrassing? Why do you say it's embarrassing?
Well, you know, for one thing, that shows how poor you are when you don't have teeth. I mean, everybody knows that. You probably can't afford dentures or something like that.
Susan Wells is in between jobs right now and qualifies for Medicaid under the expansion. She hopes that when she gets her teeth fixed, she'll start working as an Uber driver.
I want to work, as an Uber driver, some way where I can, benefit. If they just give the insurance, I'll pay taxes, do everything will be fine.
Oh, really? First, I want to get you numb, as we always do.
Yeah.
Susan was mid-treatment, so the non-profit where she goes for dental care said they'd pick up the tab. The governor's cuts to dental turned out to be a PR disaster. Just days after we talked to Susan, he reinstated benefits. But people under Medicaid expansion still face the possibility of losing their health insurance if they can't prove they're working 80 hours a month.
Everybody used to work in coal mines and stuff like that, and there are no coal mines no more.
No, there's nothing. He goes out and tries to find odd jobs every now and then, but because we got to make some kind of income right now.
There just ain't nothing to do around here no more, period.
Sarah and Pop Jaw Woods became part of the Medicaid expansion under the Affordable Care Act, and it's helped cover treatment for Sarah's back issues and Pop's high cholesterol.
Until 2014, I never did have no insurance. If I had to go to the doctor, I paid for it out of my pocket. When this insurance come out in 2014, it was the best thing that ever happened to us.
Before insurance, how would you have afforded the medicine?
I couldn't.
You wouldn't have been able to afford any of them?
I wouldn't have been able to get none of that. I wouldn't even be able to go to the doctor to find out why I need this medicine, you know what I'm saying?
When they heard the governor got approval from the Trump administration to make people work for their Medicaid, potentially kicking 95,000 people off the program, the Woods joined a class action lawsuit.
We're poor. We want to make sure the poor people have insurance, you know what I'm saying? Because me and her have been poor all of our life, and we know how it is to have insurance and not to have insurance. And I hate to say it, but the people that's fighting to take the insurance away from us is the rich people.
Just days before the work requirement was supposed to roll out in July, a federal judge sided with the Woods and ruled that hiking Medicaid premiums and adding work requirements goes against the fundamental purpose of Medicaid, which is to insure low-income people. But that ruling hasn't stopped the governor, who's still intent on rolling out his plan by the fall, and the Woods, who make around $1,000 a month, are worried that they won't be able to afford it.
The rent here is $300, then your electric, your water, then if you have a phone, you got to pay that. We make it month to month.
Right.
And sometimes we don't even make it at the end of the month.
At the heart of the debate over work requirements taking place across the country is a deeper philosophical fight about what Medicaid is. To some, it's a health insurance program where the more people you have insured, the better. To others, it's a welfare trap that should have as few recipients as possible.
There is dignity associated with earning the value of something that you receive.
Governor Bevin and the state health cabinet didn't respond to repeated requests for an interview. But we sat down with Republican State Representative Adia Wushner, the chair of Kentucky's House Committee on Health and Family Services.
Why do you think that work requirements are going to work?
It's an incentive. I think that there is dignity in work. It's something that is about the human person. So often I say that sometimes our charity becomes toxic to people. In our wanting to help them, sometimes we've hurt them.
In a sense, you're making people work for their healthcare.
Let's make sure we're always clear on, we're not talking about the vulnerable, but we're talking about a population that has the capabilities of working. I think people go to work every day so that they can have the benefits and they can have the means to support their family. And I believe if you really got down to it, people want to feel like they're contributing. We rob them of that opportunity if we keep them in a system that long where it sort of disincentivizes them to go back to work.
There doesn't seem to be a concrete plan of how you're going to actually bring sustainable work to those parts of the state, to the rural parts of the state.
It gets lost because we're talking about healthcare. But then if you go and you talk to workforce development people, you're going to hear all the stuff that they're doing. The jobs will come. We have to have the people to work.
But some doctors in Kentucky say that rolling back health benefits will lead to less people working, not more.
These are my people. These are mountain people. I was born and raised here. I was in their shoes at one time.
Dr. Bill Collins is the dental clinic director at Redbird Mission, which serves 3 of the poorest counties in the state.
So when you hear politicians talking about the fact that people need to work so that they can sort of be healthy, contributing members of society, and yet in the same breath they are taking away health benefits, what do you think?
I think you're defeating the purpose. You've got to have people healthy in order to be able to work. If you're an employer and somebody walks in and you see black teeth, you're going to take their application and it's going to be put back in the file. I think that no one should want to be on a habitual Medicaid or a lifetime on Medicaid. I think Medicaid should be a way out of poverty. Let's get these people healthy, let's find them jobs, and then help the next person.